Patients presenting with acute myocardial infarction are at increased risk of heart failure and death. Sodium glucose cotransporter 2 inhibitors improve cardiovascular outcomes in high-risk patients with diabetes, chronic kidney disease, or heart failure, but their effects following acute MI are unknown. A new trial assessed the benefits and risks of the SGLT2 inhibitor Empagliflozin in patients with acute MI and an increased risk of heart failure. In this international event-driven double-blind randomized trial, 6,522 adults who had been hospitalized with acute MI and had either a newly developed left ventricular ejection fraction below 45% or signs or symptoms of congestion requiring treatment, or both, plus at least one additional factor that was known to be associated with hospitalization for heart failure or death from any cause, were assigned to receive empagliflozin at a dose of 10 milligrams daily or placebo plus standard care. The primary endpoint was a composite of hospitalization for heart failure or death from any cause, as assessed in a time-to-first event analysis. During a median follow-up of approximately 18 months, the percentage of patients with a primary endpoint event did not differ significantly between the groups, occurring in 8.2% of empagliflozin recipients and 9.1% of placebo recipients. A first hospitalization for heart failure occurred in 3.6% and 4.7% of participants, respectively, and death from any cause occurred in 5.2% and 5.5%. The percentage of patients with serious adverse events was similar in the two groups. The authors conclude that in patients at increased risk of heart failure following acute MI, empagliflozin did not lead to a significantly lower risk of the composite endpoint of a first hospitalization for heart failure or death from any cause than placebo. Full trial results are available at NEJM.org.